is a board-certified plastic surgeon who specializes in anti-aging techniques. Please welcome Dr. Steve Teitelbaum to the show. And his patient, Linda, who's also here with him. And also welcome 56-year-old Anne Marie Wishart. And she says that there's a natural way to stay young. Welcome her to the show also. Okay, yes, ma'am.
To the surgeon, how much can a lift goes for, lift? Because
the approximate cost of an eye, what, a facelift or an eye lift? Eyes.
There's a lot of variation around the country, and there are different kinds of eye lifts depending on exactly what is bothering the patient and what their body needs to have done, but roughly from $1,500 to $5,000.
I lost about 100 pounds, and I have a lot of loose skin on me. How do I get a tummy tuck? How much does it cost, and is it painful?
Dr. Teitelbaum,
tummy tucks are very frequently done procedures, oftentimes for people who have lost weight, and they have an excess of skin there. And like the gentleman said, working out is very important. We always make our patients or do our best to get them to work out, but you're right. When the skin's loose and saggy, it needs to be removed. And we can make an incision that goes across your belly, right in the panty line, and remove that excess skin. The cost varies around the country. I'd say $3,000 to $10,000. You go to sleep for the operation, takes about 3 to 5 hours. And the recovery takes about 4 or 5 days, and there shouldn't be very much pain.
Well, you know what, Dr. Teitelbaum, you and Linda, you have gone through how many surgeries with Dr. Teitelbaum?
I've had 4 different surgeries on my face.
I think what we ought to do is let's take a look at Linda before. Let's take a look at before.
Oh.
There's Linda before, and you can put up an after picture. We have the after right here, and there's an after, but I think just come in closer on his face, and you'll see what after's like. What all did you do, sir, Dr. Teitelbaum?
Well, Linda complained to me about a number of different things. She thought that she looked old. She thought that when she went out and got dressed, she just didn't have that feeling of confidence when she went out. She complained about these lines that go from her nose down to the corner of her mouth, which were quite saggy, lines down here, and very irregular skin. She was a smoker, and she's had a lot of sun exposure. So what we did is, in the first operation, we did surgery to relift the skin up here. We did a facelift.
So you did a facelift first?
Yes, with a brow lift, working also some work on her neck and on her eyes. And then in a second procedure, we did laser treatment of her face, which tightened her skin, thickened her skin, and took a lot of the skin color, texture, irregularities away. And now you see she has a much more even color, more youthful look to her face.
How old are you? Can I ask you that question?
I'll be 50 in April.
50 in April. You look wonderful. And I mean, before you had this done, were you starting to feel bad about the fact that you were aging?
Yes, I didn't like what I saw in the mirror. I didn't have confidence that I thought I needed.
Now, Dr. Teitelbaum is probably one of the best plastic surgeons in America, and so you get an opportunity to charge a little bit more. But what would the work, an average price for everything that was done to her cost?
Probably $15,000 to $20,000 or $25,000, depending on if you add in the anesthesiologist, the surgery facility, the surgeon's fee.
15 to 20, but now people just went, shh. But if you're 50 years old or 40 years old and you get ready to buy yourself a new Mercedes-Benz at $120,000 and pay payments on it for 5 years, why not make your face your Mercedes-Benz if you want? I don't know. I'm going to take a little break. When we come back, we'll talk to Ann and we'll find out how can you do this naturally. We'll take a little break. We'll be back right after this. We're talking to them today about how to chase that fountain of youth or whether or not it's really worth chasing. And I firmly believe that I think that if you work your whole life and you choose to spend your money, I don't care what anybody says, it's their money. If they want to go out and have an operation to make themselves look better, not to feel better, but to look the way they want to look when they look in the mirror, their business, none of ours. It's just that some of the techniques and things that are out there we need to talk about. So tell me, when we talk about an eye lift, and this lady stood up and said, what's it cost for an eye lift? But what do you actually do? We have a before picture of an eye lift, do we not? Here's before, and there's an after. So I'm looking at the before. I don't see that much difference in this particular picture. Yeah, I do.
There you go. Look at how much skin she has hanging. These are photographs that come from the American Society of Aesthetic Plastic Surgery, and this is representative of what plastic surgeons can do around the country to get this kind of result. This is someone that complained about this hanging skin you see in the photograph on the side.
Well, mine's hanging a little bit there, too.
No, I don't think so. Okay. Doesn't everybody think he looks perfect?
Oh, okay, so, but what do you have to do? I mean, how invasive of a surgery is this?
You know, this can be done under local anesthesia, going to the doctor's office. Someone can drive you home that afternoon. And it involves removing a little bit of skin from the upper part of the eye and also a little bit of fat that sometimes gets puffy and gives a full sense on the upper eyelid or on the lower. Here's a gentleman in this next photograph that people are seeing that shows a man with this hanging skin there. People feel that they look tired, they look older. Often this is done on people that are a little younger, that this one part of the body seems to accelerate ahead. The wonderful thing about plastic surgery, it's not like anybody needs this done. People only need what's done, what bothers them. So that when people get dressed and they look in the mirror as they're ready to leave the house, you don't get that extra punch of feeling good. And so when someone comes to us, we try to address the things that are bothering them.
And this is a brow lift, but now the brow lift can be done with the botulism, basically, right?
Well, it's actually, I'd rather you call it Botox.
Botox,
it's Botox.
It's Botox.
Yeah, right. It's the toxin in extreme overdose taken through the mouth is a disease called botulism, which has never been associated with the use of Botox.
Okay.
So they're very different things, and people should know that.
But you can do that with Botox.
Some of it. In other words, a brow lift can elevate brows that are sagging. Sometimes you see people and their eyebrows are hanging into their eye sockets, and they're lifting their head a lot to bring their up, and you see these lines here. That's when you need to do a brow lift to bring the brows up into a nicer position. But the Botox is when you only have muscles that are hyperactive, like I'm doing right now. People look angry a lot of times, and you put a little medicine in here, just relaxes the central area here.
I do it all the time, but it's kind of like me, you know.
That's right.
All right, now how about the facelift? This is when you do the whole thing.
Right, this is a lady who has a facelift. The predominant thing that a facelift does is that with aging, fat sags. Originally on the cheeks, it starts to fall down and create these folds here, folds down here. It disrupts a nice clean line to the jaw. So with the facelift, we go under all of that fat and skin and bring it up. And you see in this patient here, much smoother contour in here, smoother contour in here.
10 years off this lady, 15 years. Look, 15 years off this lady.
Wow.
Yeah, so
20 years off that lady.
This lady also had a chemical
Don't get mad
peel.
at me either. She's out there.
If people are interested in having this kind of work done, it's important to be sure that you're going to a board-certified, qualified plastic surgeon.
And we're okay. Well, look, I'm almost out of time, so I should say it this way, and I think you're absolutely right. There are a lot of things that are coming down the pike, a lot of things that are out there, information that you'll read the next couple of months. I mean, there are things that are going to happen by come January in the news that will tell you about all these kinds of anti-aging techniques. What you need to do is contact a doctor, a viable doctor who's a surgeon or an endocrinologist or a plastic surgeon. Contact one of them and say, hey, look, this is what I heard. What do you think? And get some information back from these people. Make sure you check out a doctor who doesn't have any problems with the American Medical Association and other things like that. Get the information from them, and then you make a decision for yourself as long as you are educated. I cannot end this show talking about plastic surgery and other things without asking a question of all the doctors on the stage. Here in New York, we know about this story, but a lot of the country does not. I'm just going to show you a picture, and I want you to comment on this picture. This is what a plastic surgeon did to someone. Now, I don't know whether or not she asked for it or not, but a lot of us in America have seen this photo. And a lot of people in New York see it almost every week because this lady and her husband are in the middle of a very bad divorce. How can a surgeon do this?
You know, 99% of my patients are absolutely normal people. They're your friends, your family members, your neighbor. They ask for reasonable things. I don't know anything specific about this person or
I'm
this
just
situation.
looking at a face.
It's only a small minority of people that would ever want to do that to their body, and even a smaller number of plastic surgeons who would consent to do it. So in those very unusual situations where these two kind of people get together, things like that can happen. But that is not at all representative of the specialty or what the public wants to have done.
Actually, now also, like here in New York, we get to travel a lot on trains and on buses.